Hi, I'm Sarah Bruce and welcome to EHI TV, coming to you from EHI Live in Birmingham. Today I'm joined by Sean Riddell, who's the Chief Executive of EMIS. Welcome, Sean.
Oh, hi, Sarah.
Now, you're giving your session later on today as part of the Connect All stream. Tell me a bit about what you're going to be talking about.
Well, the talk's called Fahrenheit 451. You know, for all the sort of literati out there, it's to do with the temperature that paper burns. You know, and really it was a cheap gag around paper light, you know, trying to make the NHS paper light. Because the amount of paper that flows in the NHS and the way it actually does technology, probably no other industry in the world would do that. You know, it would have been more electronic interoperability. So that's the core of the talk.
So obviously there's going to be a lot of focus around interoperability. And one of the unusual things about EMIS is the collaboration with actually quite a strong competitor in the market, InPractice. Tell us a bit about how you're collaborating with them.
Yeah, that was a formation of a company called Healthcare Gateway Limited, which is a joint venture between EMIS and InPractice. So we each own 50% of the company. And if you take EMIS and the number of electronic health records in our systems and add that to InPractice, you then start finding that you've got, you know, the vast majority of the population of the UK there. And that data no longer needs to reside just in the GP system. You know, you need to sort of liberate it so it can follow the patient journey. But then the reverse is also true. How do you get a discharge summary back to that GP record without having to, you know, invest in scanning, copying paper, you know, then highlighting the paper to get clinical pertinent bits of data out and put it into the system? So the whole thing with this is the use of something called the MIG, the Medical Interoperability Gateway. You know, so let's take one trust in London that I know sends 750,000 discharge summaries to the GPs they service. And they think at a cost of 50p a time. Now, you could probably duplicate that with the cost for the GP. Now, why isn't that then sent as a structured electronic message? You know, so that's why the MIG is compliant with the ITK, you know, the Information Toolkit. So it can take an electronic CDA message, or in fact any structured message, and send it to the originating GP, and hence, you know, saving money and delivering more for less.
So to what extent is the MIG actually being used at the moment?
So the MIG is being used individually as components to kind of join up. Let's take an example, detailed care records, you know, being shown in Ad Astra or System C, but also to show the flow of discharge summaries from InPractice systems, you know, into the secondary care systems. Now, what we're doing at the moment is combining the technologies to make a single product, and we're working with people for early pilots.
And you mentioned the Interoperability Toolkit earlier on, and presumably you've invested some time and a lot of effort into the ITK. What were your thoughts on the recent announcements around the ITK, that there's not going to be a second round and that it's going to be more, you know, interfaces around, you know, kiosks and that kind of thing? Is that slightly disappointing for EMIS?
Well, somewhat. Your standards, there are a lot around the world, you know, and you can actually transform, you know, one standard to another. Interoperability isn't in fact about the standard, it's in fact the commercial intent to share data. And the biggest thing that stops interoperability is, you know, one could say commercial protectionism. You know, and the healthcare IT industry is still quite kind of naive, you know, if you compare it to the rest of the world. Nearly all industries around the world know that you should be sharing data and moving it electronically from one point to another. You know, and it's that commercial intent of the companies to share data for the greater good of the patient, rather than try and protect the data in their systems. You know, so somewhat, you know, we're not disappointed. We think it's a very good start, but there are many other message formats you can use. You know, people talk about the Kettering message to do with discharge summaries.
Yeah.
Now, shockingly, I think that's now 18 years old. And where is discharge summary data flow in the NHS now? You know, why does a hospital pharmacy have to phone a GP if they want to know what medication the patient's on? You know, that is all really needing to stop to improve the care of the patient and improve the data flows.
So you talk about companies being willing to share data, and in your case, you know, partnering with companies. Do you think that companies are going to need to do that to succeed in this new kind of environment that we're seeing around interoperability?
I personally believe no company should be allowed to sell healthcare software into the NHS unless it's interoperable. You know, and it is, in today's day and age, you know, the importance of having that cradle-to-grave record available, you know, in an all-but-only concept. So any healthcare professional that can benefit from seeing that to care for the patient, that data should be mobilised. And I just think it's a matter of time that all companies will do so.
Yeah. And moving slightly away from that, but obviously sticking with the kind of theme, one of the key projects that you're working on at the moment is, of course, EMIS Web. Tell us a bit more about EMIS Web and the rollout. How's that all going?
Yeah, so EMIS Web is not a new product. We currently have 15 million electronic patient records in EMIS Web. So we've been using it for cross-organisational healthcare outside the GP sector. The GP sector is interesting in that to roll your software out, it needs to be formally accredited and conformed. So it got its conformance tick in the box on the 7th of September, and we've currently rolled it out to 15 GP practices. So it's early days, and we're doing what's known as a controlled rollout. So that we actually make sure that we listen to, the early adopters and make the tweaks to make sure that they, basically they continue to be able to run their businesses and look after the care of their patients.
And are those practices switching off the old EMIS software and switching to EMIS Web, or
Yes.
are they running in parallel? Or?
No, the 15 sites are running purely on EMIS Web.
Okay.
But we currently have, as I said, 15 million patient records running in parallel.
Yeah.
Because as soon as you've then shared those records, you can then start having, cross-organisational audit. So again, numerous examples of EMIS Web saving an awful lot of money for different healthcare communities.
Okay, so what's next for EMIS? Good profits this year. You've got EMIS Web rolling out, a lot of focus on interoperability and the MIG. What's next?
Well, it's actually now to start delivering, delivering on some of the promises. EMIS now own 25% of the high street pharmacy market. The pharmacies and the paper flow between the pharmacies and the GP, and the number of phone calls between the pharmacy and the GP, need to be cut down. So again, what we're working on now is creating an interoperable product between, our EMIS GP systems and ProScript, the RX system. But you also want to start sharing clinical knowledge, so that patient information leaflets can be standardised across, a healthcare community. Again, what it is about joining up healthcare, getting rid of the paper, coming back to Fahrenheit 451. The NHS needs to be paper-light. What we're going to be doing is delivering that through our technologies.
Okay, thank you very much, Sean.
Okay, thank you very much.